Good afternoon. Thank you for joining us. As you may have heard, today we had 41 new COVID-19 cases here in the state of Hawaii. This has set a new record in the highest daily count of new cases here. I just really want to assure everyone in the state of Hawaii that we expected this, that we knew that as we reopened our economy, we would get an increased number of cases. I know that you've seen many stories across the country about governors and states reopening too quickly and moving to threaten the health and safety of their communities. I want to assure everyone that the state of Hawaii did not open early. And we have always been driven by the data and the conditions that we see, and we continue to know that we are keeping our community safe and healthy. Even with this new case count, Hawaii continues to lead the nation in the lowest number of per capita cases, the lowest infection rates, and amongst the lowest fatality rates in the country. This number of cases is manageable right now. I just want to assure you, when we started the conversation about reopening our economy, we needed to see three conditions prior to moving. First was 2 incubation periods of trending downward of cases. And as you may recall, we saw 4 weeks of lower and lower cases. We actually had 2 weeks where the case counts were 5 or less for full 2 weeks. The second condition was to assure that our healthcare system had the capacity to respond to the number of cases that we see, and we continue to have utilization rates below 50% in the number of beds being utilized, ICU utilization, and the number of ventilators. So we continue to have more than adequate capacity in our healthcare system. And the third condition about reopening our economy dealt with the ability to test and contact trace. And once again, we've greatly increased the number of tests that we can perform here in the islands, and the number of people who have been trained and able to execute contact tracing once we have a confirmed positive case. So I really wanted to reassure everyone, but it is a constant changing situation all across the state. We monitor the conditions. We do know and are aware of many challenges that continue to come up over and over and over again. So really want to assure everyone that we are monitoring, and the state is well prepared to deal with the increase in COVID-19 cases. I know that many are wondering if we will look at walking back some of the more recent reopening activities. I know that many are asking whether we will be delaying the launch of the pre-travel testing program that we had announced last week. I want to assure everyone in the public that the health and well-being of our community is the highest priority. We will be data-driven and listen to the recommendations of the experts like Dr. Anderson and Dr. Park. We will continue to involve the mayors and the emergency responders and other leaders in the discussion as we monitor the conditions and consider whether it's appropriate to roll back different actions taken. So I really want to encourage everyone, once again, we can only be successful in this fight against COVID-19 if we work together as a community. All of us need to take personal responsibility in our interactions, in wearing masks, in staying home when we're sick, in keeping our children home when we're sick, in washing your hands and using hand sanitizer. We need to be relentless in this marathon fight against COVID-19. Joining us today is Dr. Bruce Anderson and Dr. Sarah Park, who will be giving us an update on the recent increase in the cases that we see. Thank you so much for being here.
Thank you very much, Governor. Dr. Anderson.
Thank you, Governor. Good afternoon, everyone, and thank you for joining us today. Today we have 41 new cases of COVID-19 in the state. This is the highest single-day number reported to date. Last Friday we reported a high of 29 cases. Back on April 3rd, we had a report of a high of 34 cases. These high numbers are a concern for the department, and they should be for everyone else. It's an indication that disease activity in Honolulu is circulating more widely. We still have the lowest number of cases and deaths in the nation and have the ability to change the curve, to get the curve back down to where I think we would want to see it going forward. But the trends are very disturbing. Over the past months, most of the cases have been associated with known cases or clusters of cases. We are now seeing more cases without a history of exposure to other known cases or clusters. We have increased surge staffing within the department and are in the process of hiring our newly trained contact tracers. I do not believe in the short run we have any significant issues associated with contact tracing. Nevertheless, it should be recognized that contact tracing is a reactionary step. It helps to assure that we've found those who are likely infected, but it does not substitute for the social distancing, the face mask wearing, and the other preventive measures we've all been taking. We must adhere to masking and physical distancing, as no amount of contact tracing and testing will effectively combat the respiratory pathogen that is now circulating in our community. We anticipate these numbers will likely continue at these levels with the activities in the state. More people are out and about. We're enjoying businesses being opened. And with the prospect of our schools opening soon, college students coming back to Hawaii, this all depends on our ability to keep the disease in check and to provide a safe environment for those activities to continue. Some of the cases are associated with closed spaces like gyms with poor ventilation. Some have limited workplace spread, sometimes associated with lax wearing of masks and other physical distancing. Many cases are household contacts, which emphasize the need to self-quarantine if you're exposed to someone who is positive, who is a positive case, and to self-isolate at home if you are a case. The clear message is to wear a mask and stay away from others at home if possible. Dr. Sarah Park will be providing more information on some of the cases and clusters we are investigating. Thank you.
Thanks, Bruce. So our team at the department has been busy investigating a number of clusters and cases, primarily on Oahu. I think we should also remind folks that although most of the disease activity is Oahu focused, the danger or the risk is statewide, and so we do monitor and investigate the occasional cases that are showing up on the neighbor islands as well. And so we have to be mindful statewide about the potential risk from this disease, that it is ongoing. We're in the middle of a marathon. Actually, we're probably not even in the middle of it. We're still in the beginning climbs of it. And so it's going to be a long haul for all of us. And the disease that we're seeing, the disease activity we're seeing primarily in Honolulu, is a reminder of that. In terms of the investigations that we've been engaged in, I could go through the entire list of all the clusters and such, but I think the point is that we're seeing disease occurring in clusters that involve as few as a couple people to as much as 15 people, all associated with whether it's a gathering such as a Father's Day party, one such one that we keep seeing more and more cases, chain of cases associated with a Father's Day party, for example. We've seen, as mentioned, a gym cluster, and we've seen others associated with, we've seen a business trip that went to a neighbor island, actually to the Big Island, that we're seeing cases associated with that, as well as trainings that held by like Hawaiian Airlines, for example, where the number of individuals in the training has been involved. And the common theme we're seeing oftentimes is that people are letting their guard down, that our community is thinking, has interpreted reopening businesses and getting back together as it's safe to be together again. And, you know, to a certain extent, that's true, but to another extent, it isn't exactly true, because we're living in a world where COVID exists. And what that means is that even among our friends or family we haven't seen in a while and that we aren't going to be seeing consistently day in, day out, they're not part of our, what we call our bubble, if you will, we need to mask up. And we need to keep our distance. So it's okay to see your friends again. It's okay to be in a training for business and such, but keep your distance and mask up around each other, wash your hands. And that's, unfortunately, that's our world for some time yet, until we see a vaccine or an effective medical treatment or other interventions that may help to combat this virus. And so that's what I hope our community remembers out of all this. As mentioned by our director, we do have the resources right now. We've surged in the department to have the ability to contact trace. But contact tracing and testing doesn't solve everything, just like masking alone doesn't solve everything, or physical distancing alone doesn't solve everything. It's all of these things in combination together that will help combat the virus, and will make sure that Hawaii continues to be a safe place and is seen as a safe place. So that's it. Thank you.
Thank you very much, Dr. Park. Well, with that, we'll open it up to questions from the media. We'll make one cycle, and then if the reporters would raise their hand, we'll follow up that way.